Under parasiticides, we're going to break them down into the isoxazolines. And for those of you who have been following me for any time at all, you know that this is like part of my soapbox all the time. Moxidectin, I've talked about that one quite a bit too. Fipronil, spinosad combined with milbemycin, selamectin, and then imidacloprid and flumethrin.
Every prescription medication comes with an insert that details potential risks and side effects. The problem is, most pet lovers never see that insert, or are even informed of any potential risks before use. Whether you ultimately decide to use these medications, alternatives, or a combination of the two is your choice to make. The goal of this video is not to spread fear, but to educate and empower pet parents so you can ask informed questions and make the best decisions for your own pet.
I was asked to come up with the 10 most commonly used dangerous drugs in veterinary medicine. I'm not talking about holistic medicine as much as I'm talking about traditional veterinary medicine, except I'm talking about it from the point that, really kind of gets me and why I do what I do, because it makes me mad when I see these things used and I see damage being done to our pets. I've always wanted to be a veterinarian, and then I hated it. And I was one of those veterinarians that if I hadn't found a new track, I would have left the field because I hated what I was doing and I hated that I couldn't help. Through all of my pathways that I've taken, I now finally feel like I am making that difference that I set out to make. And I feel like I have so many tools in my toolbox and things that I can warn you about and things that I can give you education about that will help keep your pets healthy, help decrease that chronic disease, and help you avoid tragedy. When we're talking about these chemicals, we are literally talking about things that cause tragedies for pet owners. It breaks my heart to think that my profession is contributing to the demise of the animals that we all love and the reason why we become veterinarians. The first group of drugs that we're going to, and when it came down to it, I couldn't just say one drug. It ended up being classifications of drugs because there's so many. So our first topic today is parasiticides. I have 6 different groups under that. If I just talked about an individual one of them, we'd have the 100 worst drugs used in veterinary medicine. So under parasiticides, we're going to break them down into the isoxazolines. And for those of you who have been following me for any time at all, you know that this is like part of my soapbox all the time. Moxidectin, I've talked about that one quite a bit too. Fipronil, spinosad combined with milbemycin, selamectin, and then imidacloprid and flumethrin. So we're going to talk first about isoxazolines. Now, these are the drugs that came out in 2014, and I know it was 2014 because that was when my first book, From Needles to Natural, came out. I was ready to send the book in March of 2014 to the publisher for final editing and putting it together, and I said, wait, hold back. I can't do that because this class of drugs just hit the market. And I think at that time it was just Bravecto. It may have been Bravecto and NexGard. And I looked at what these were and it scared the poop out of me. And I said, nope, I can't send this book in until I include in my chapter on flea and tick prevention and chemicals and parasites, I have to include something about these because they scare me and I want to scare people away. And so I'm still trying to scare people away. So under isoxazolines, the list keeps getting longer, and Dr. Lori Koger sent me a new one the other day for cats. And the new one for cats includes NexGard, Praziquantel, and something like milbemycin, except it's not that exactly. It's another mycin. But it's to prevent fleas, ticks, heartworms, and tapeworms. And you're supposed to give it monthly to your indoor kitties, or all kitties. Talk about trying to kill them. And by the way, if the flea prevention in it really worked, then why do you need tapeworm prevention? Because they get fleas from eating mice or eating tapeworms. So if we're preventing fleas, then we shouldn't have tapeworms. So, duh. It's an oxymoron in my opinion. But anyway, so these include Bravecto, NexGard, Simparica, Credelio, Revolution Plus, and now this new one that I can't remember it. But they just keep coming up with bigger and better and, in my opinion, much worse, more harmful combinations of these drugs. It's like, well, if we can combine 16 together, isn't that so much better than just having one? The answer is emphatically no. Side effects from the isoxazolines: vomiting, diarrhea, anorexia. You're going to hear that repeated over the next 2 weeks: vomiting, diarrhea, anorexia, because any drug that you give can cause nausea and upset stomach. And by the way, most of these drugs are going to either kill the microbiome or really mess with the microbiome. So vomiting, diarrhea, nausea, anorexia. itching and skin lesions. And I saw that somebody said they had 2 dogs that they gave NexGard to like years ago, and the dogs instantly broke out in pustules and draining tracts, and it's been years and they still cannot solve the skin problems with these dogs. So the NexGard is the highest on the list for the skin lesions and itching. These are all neurotoxins, which means they affect the nervous system, and they are only supposed to affect the nervous system of insects and arachnids. So mites would fall into, I think that's an arachnid. Anyway, the 8-legged and the 6-legged critters. So they're supposed to kill skin mites, and they're supposed to kill fleas, and they're supposed to kill ticks. Well, they're pretty good at that. Unfortunately, the receptors on the nerves that they are supposed to bind up and attack in the nervous system, for some reason, some of our dogs and cats are also really sensitive to these chemicals. Many of them are not, which is why the drug companies can get away with saying, oh, well, we've sold 50 million doses and we've only had 5,000 animals die. So what's your big complaint? Well, my big complaint is 5,000 animals died. And actually, it's a lot more than that. But nobody knows why some animals are hyperreactive to these and some are not. So because it's a neurotoxin, we can get tremors. We can get ataxia, which is wobbly. They walk like they're drunk. Seizures, coma, aggression, and behavior changes. I have seen a lot of animals, and I think I talked about this one recently with you guys. We got an email from Cocker Spaniel Rescue. They took in this little cocker who had been given Simparica Trio, I believe, and the dog started aggressively attacking his little nubby tail. So 60 times a day, this dog would start spinning and attacking his tail, growling at it, snarling, wanting to literally bite his own tail off, and didn't respond to seizure meds. And of course, everybody was like, oh, no, we don't, it's a seizure. Why is it happening? Well, so the first thing I said was, what neurotoxin was this dog given? Yep, the dog was given this. So the dog's undergone the detox program and is doing better, and he's down to about 10 times a day instead of 60, but that's still a big problem. So you have a dog that the owners were like, we can't deal with this. And now we're trying to adopt this dog out to someone who hopefully has a really big heart and can deal with this. But it's sad to see the dog do it, and it's upsetting for people. And I've seen a lot of animals I've done a lot of consultations for people who have given these drugs, and their dogs become aggressive. And it's not something you can train out of them. They literally have lost their mind. So the only thing we can do is brain support. From a TCVM perspective, these cause a blood deficiency. So we get a liver blood deficiency and a heart Shen disturbance. So we can treat it from that perspective, but very, very difficult. We can have organ failure and internal hemorrhage. And the reason for that is that this class of drugs is used in people. You know those commercials you hear about, instead of taking warfarin, take this drug to prevent clotting? Yeah, well, same derivative family. Some of those drugs that are used in people are the same derivative family. And so what we get with some of these animals after they are given these drugs, suddenly they hemorrhage into their chest or they hemorrhage into their abdomen and they die. And then when we do the autopsy or they go to the vet, they go, oh, I have no idea. I must have autoimmune hemolytic anemia. I must have autoimmune thrombocytopenia. Or maybe he hemorrhaged because we stopped the clotting from being able to occur because we gave a drug that stopped clotting. So again, small percentage of animals that do this, but if yours is one of them, it's 100% for you. Blindness and dry eye, another problem with these. There was a paper presented at one of the international ophthalmology veterinary conferences talking about retinal degeneration, retinal inflammation, optic nerve inflammation and degeneration, and blindness associated with the use of these drugs. And I had a link to that paper years ago, and I went back and tried to find it, and it's been taken down. So, big pharma does not want people to know these things. I had a case of severe dry eye. Medium to large size dog was given 1 dose. I think it was Bravecto, but I'm not 100% sure. And the dog developed very dry eyes, and they did the tear test, and normal measurement is 15 millimeters at 1 minute. This dog had 0. We went through detox for months. We went through blood tonic foods. We did everything that I had in we did different kinds of drops, everything I had in my toolbox. And the dog went from 0 to 2 in about 3 months. That's nothing. These people are having to put drops in this dog's eyes 4 to 6 times a day at a minimum for the rest of his life, unless there's some miracle that occurs 2 years down the line. I said seizures and coma and death, and we have seen certainly a lot of death from these drugs, and they make me crazy. All right, the next one after the isoxazolines is Moxidectin. Moxidectin is found in the injectable heartworm preventatives, ProHeart 6 and ProHeart 12, and also in topical Advantage Multi. Moxidectin was originally used as a horse dewormer, and I would never use it in my horses because if you've ever seen a horse have a seizure, you think it's ugly when a dog has a seizure. It's really ugly when a horse has a seizure, and I've seen them, and it's just no fun. So again, vomiting, diarrhea, anorexia, behavior changes. Again, we're talking neurotoxins here. Trembling and ataxia, seizures, anaphylaxis, which is a really bad allergic reaction with hives, facial swelling, shock. With the Moxidectin, we have seen immune-mediated hemolytic anemia, immune-mediated thrombocytopenia, liver failure, kidney failure, and death. And between 2001 and 2004, when ProHeart 6 first came out, there were over 500 reported deaths from the ProHeart injection. It was actually taken off the market because the FDA actually finally did something right and stepped in and said, wait a minute, whoa, it seems like we're getting a lot of adverse reactions. And by the way, it was only 500. We have so many more than that in the isoxazolines, and they're like, we haven't had enough yet. But there were 500 in that little 3-year period that actually got reported. So it was taken off the market, and we thought, yay, we did something right. And then a year or two later, it's back on the market. So I thought, okay, well, maybe they changed the formulation. They did something different. Nope, zero changes. What they did is they came to an agreement with the drug company and said, okay, well, you have to print up this piece of paper that is given to the pet owner before the injection is given. And it explains all the potential side effects and that it should not be given to animals in kidney failure, liver failure, senior pets, maybe not, pets with cancer, whatever. I have yet to talk to any pet owner who has ever been given that piece of paper before the injection is given. And that was literally the only way it was allowed back on the market was if the veterinarian handed that to the owner first. I have yet to talk to anybody who's ever gotten that piece of paper. In their infinite wisdom, then the drug company said, wow, that was so good. We'll triple the dose and we'll make it last for 12 months. So as if we weren't given enough toxins before, now we have one that lasts 12 months. And bad news. They have side effects. Good luck. There's nothing you can do with these. Problem is they don't know. They just, if you are the pet owner standing in your veterinary office, the doctor with or without the white coat, because not everybody wears them anymore, but they're standing on the other side and they're going, well, yes, I've read the literature, whether they have or haven't, but yeah, no, perfectly safe. Perfect. Yeah, this is great. You don't have to worry about giving that pill every month to prevent heartworms. We'll do this once a year. Don't worry about it. We'll send you a reminder. No brainer for you. I'm sorry. Are we that lazy? I guess we are. Anyway, so let's talk about Fipronil. Fipronil is the active principle in Frontline and Pet Armor Plus. Pet Armor Plus is the one that's sold in like Walmart, and I think you can even get Frontline in a lot of over-the-counter places. But I've never found Pet Armor Plus to work at all at anything, fleas or ticks. It's supposed to prevent fleas and ticks. Never had good luck with that one at all. Frontline has been one of the topical parasiticides that's been out the longest. Like they've been out for a very, very, very long time. If you just went and looked at number of adverse events, you'd probably find more for Frontline than anything else, just because more doses of that have been sold because it's been on the market longer. What you really want to do is what's the percentage, like how many doses have been sold versus how many adverse event reports have been reported. And just remember that less than 1% of adverse events actually do get reported. So what numbers you're looking at, multiply them by 100 at least, because they just don't get reported. All right, so for Fipronil, thyroid tumors, it's a carcinogen, and we put it on every month. Kidney and liver failure, it's a neurotoxin, so ataxia, tremors, abnormal gait, muscle cramping, hyperreactivity, like noise reactivity, that sort of thing. Behavior changes, agitation, like the nervous pacing and I just got all this angst. Skin irritation and hair loss at the area where it's put on. Seizures, because it's a neurotoxin, and we always have to put death down there because there's a bunch of those going on too. So that's Fipronil, and that is being used in a lot of different things, and that is the one that the studies done on the rivers in Europe found very high doses of Fipronil, and they think that it's coming from people putting these chemicals on their dogs, and then the dog's swimming and washing their dogs. It's getting in the waterway. Like, so not cool. All right, so spinosad with milbemycin. This is a flea preventative, the spinosad, and then milbemycin is the heartworm preventative that is in Interceptor and Sentinel. But this particular combination of spinosad and milbemycin is the drug Trifexis. Trifexis, there have been over 700 reported deaths from seizures with this one. Vomiting, diarrhea, anorexia, depression, lethargy, itching and redness, labored breathing, trembling, ataxia, paralysis, blindness, aggression, behavior changes. Is any of this starting to like sound repetitive? Because this is what we get when we give a neurotoxin to our pets. So I really recommend not using Trifexis as your heartworm / flea preventative. And I know everybody wants to know, well, what would you use? Like, if I was desperate, I mean desperate, and I needed flea and heartworm preventative in one thing, I would use Sentinel, which is milbemycin, but it's with lufeneron. And I've seen less problems with that, but I could have included that on this list too, because all of these drugs have the potential of causing serious side effects. For my patients where people really feel like they have to use a chemical for heartworm preventative, I've always recommended plain Interceptor, but I had many patients that reacted to that and could not take that as well. All right, so selamectin, which is Revolution, this is another topical. Vomiting, diarrhea, anorexia, hypersalivation, which is from nausea. Shocking. Again, neurotoxin, trembling, ataxia, seizures, coma, death, blindness, dilated pupils. Because it's put on topically, alopecia, skin rash, itching, burning, and MDR1 dogs are more susceptible to the side effects. And we did a webinar on MDR1 a few weeks ago, so you could go back and look that up. I can only think of a handful of times in my life that I have used Revolution, usually for people who had sarcoptic mange problems that they just were not able to get rid of using natural treatments. Personally, we got sarcoptic mange with our dogs once. I used a single dose of low dose of ivermectin oral once a week for 3 weeks, solved the problem. I did not use topical Revolution. I have one client that I remember using topical Revolution. She tried for weeks to use natural products to get rid of the sarcoptes. Everybody in the house was infested. The dog was bald. She went to Revolution. It did solve the problem. And if I had to pick between Revolution and an Isoxazoline, I'd go Revolution over an Isoxazoline if I had a mite problem any day of the week, but I don't like to use either of them. Next on our list is imidacloprid with flumethrin. This is the Seresto collar. So this one came to the forefront when the EPA was questioned by Congress about, got all the way to Congress. Like this one, somebody got somebody's ear and said, hey, dogs are dying. You need to do something about this. And it's because it's considered a pesticide. So it had to be regulated by EPA. Apparently it's not allowed in Canada. This collar is used by a lot of people. It does kill fleas and ticks. Again, vomiting, diarrhea, anorexia, hypersalivation from nausea. It is a neurotoxin, trembling, ataxia, seizures, coma, death, at least 1,700 reported. Blindness, dilated pupils, kidney failure, liver failure, thyroid damage. Seems like I've heard that before too. It's topical, it's around the neck. Loss of hair, skin rash, itching, and burning. And again, MDR1 dogs are more susceptible to the side effects from this one as well. Ivermectin, it has a lot of uses outside of being used as a heartworm preventative. It's used a lot in human medicine for human problems. So it's not to say that it doesn't have a place in this world. It just needs to have the right place in this world. So with the parasiticides, the big thing with this is there are no antidotes if a reaction occurs. Once you put these in the body, like you give it orally, it doesn't come back out. Once you put it topically, yes, you could give them a bath in like a degreasing shampoo, but unless you do that within the first couple of hours, you're not going to get most of that back off. So if they have an immediate reaction, go for a bath. If you give something orally or by injection, the best that you can do is detox. We have a great blog on things that you can do for flea and tick prevention. For heartworm prevention, the best thing for heartworm prevention is honestly to have dogs with a healthy immune system. The percentage of dogs that get heartworms is actually pretty low depending on where you live. For instance, when Bubba Duke, the coonhound, showed up in our backyard as a stray, he was covered with thousands of ticks. He was covered with thousands of fleas. He also had heartworms, and he also had intestinal parasites. That's somebody whose immune system went down the toilet so long ago. And before I even started doing holistic medicine, one of the things that I noticed was every time we got a dog that was heartworm positive, they also had just about every intestinal parasite, but almost always whipworms. Whipworms are not as common as some of the other parasites, but heartworm positive dogs almost always have whipworms. Hookworms tend to go along with that. And by the way, they usually have fleas because their immune system isn't fighting this infestation at all. So we lived in New Jersey, and when I became a veterinarian, absolutely, our dogs got heartworm preventative every month all year round. Then I got more holistic and I went, wait a minute, we don't need to do this every month all year round. We could probably do this seasonally during like mosquito months. So we went to a very shortened season. And then I read the Safe Heart study, which is not on the FDA. It aged out after 20 years, but I linked to it and talked about it in From Needles to Natural. The Safe Heart study using milbemycin at a lower dose. So we went to that, and we went to giving it every 6 weeks. So our dogs were getting 4 doses over the course of the summer. I said, okay, that's great. That worked. We did that for a few years, and none of our dogs ever reacted to it. And then finally I bit the bullet and said, you know what? I'm a holistic veterinarian. I'm just not going to give our dogs these chemicals anymore. So no flea tick topicals, oral. Well, they never got orals. No heartworm preventative. I'm going to keep them healthy with their raw diet. I'm going to support their immune system. I want healthy dogs. Let's see what happens. Now, yeah, I guess I'm using my dogs as an experiment. But after 5 years in New Jersey with, they get tested for heartworms twice a year. No problems. We moved to North Carolina. They're still not on heartworm preventative. Our dogs live a very sheltered life outside in the evenings when the mosquitoes are really feasting at that dusk time. So that's the time of day our dogs come inside. We don't keep them outside during mosquito feeding time. If a mosquito is biting me, then I know the mosquitoes are out and I'm spraying me with with the dogs, essential oil, flea and tick spray, and I'm spraying them, or I send them inside. So we're camping. And actually we've had no mosquitoes here, but if I had mosquitoes, my dogs would come inside and I would spray something like an essential oil to repel them. You have, options of not putting them on anything, and the heartworm preventatives work backwards. Let's say you went to Florida from September 1st to October 1st. You actually don't want to give a heartworm pill until November 1st, and you want to test before you give it. And you would give it November 1st and it would kill everything that they were exposed to backwards, and maybe October 15th. But if you give it when you come home on October 1st, you're not going to take care of the problem. It takes 6 to 9 months to develop adult heartworms. So what a lot of people do is they will not use anything and then heartworm test 3 to 4 times a year, maybe twice. Depends how risk averse you are. And if you do pick up a problem, you'll pick it up early and you'll be able to deal with it a lot easier. You have to weigh, where do you live? Are you in a neighborhood where everybody takes care of their dogs? All the dogs are healthy. None of your neighbors have had heartworm positive dogs. Because remember, the mosquito has to bite a heartworm positive dog. And then the microfilaria larvae that it gets out of that heartworm positive dog, 2 weeks in the salivary glands of the mosquito for it to mature to the infective stage. Then the mosquito has to go bite your dog and inject it. And then your dog's immune system has to be bad enough that it doesn't say, woo, foreign invader. So for all of those things to happen, actually takes a little bit of work. If the temperature drops too low, that salivary gland process stops. We have great blogs on this. It's actually a complicated life cycle. So it really is about the overall health and immune status of your dog. But here's the bad news. Let's say you have a dog who has had repeated bouts of immune-mediated thrombocytopenia or immune-mediated anemia. I wouldn't want to put that dog on chemicals. That's just asking their body to say, crap, we got to do something. So those are the dogs you really want to be even more careful with as far as giving them chemicals. HWF is not the same as a heartworm chemical that kills those microfilariae that are injected. It's setting your dog up to be able to fight that infestation better. So, well, that infection better so they don't get an infestation, and put it that way. It would depend where I lived and what my dog was doing, what his lifestyle was, whether or not I would use anything. And if I had to go back to using heartworm preventative, I, again, would go back to my milbemycin at a low dose, spread out. And that's all in our blogs, the heartworm disease transmission and prevention. So I would recommend reading through those. And fleas and ticks, definitely read the natural preventative and treatment for fleas and ticks, because there really is no reason to have to jump on these chemicals. I get really, really upset when I see people, I tried all the natural things and it didn't work. Well, if you tried all the natural things and it didn't work, then you need to try something different in that. So what I have found, for instance, from Kin + Kind, we have two different flea and tick sprays. One is a lavender base and one is a lemongrass base. And if one doesn't work, try the other one. And it may mean that you're not putting it on often enough, you're not putting it on heavily enough. And how heavy you have to use it and how often you have to use it depends on where you live, what the exposure is, because it's different for everybody. It is different for everybody. And for fleas and ticks, remember, fleas spend 5% of their life cycle on the animal. So if you are spending all of your time dousing your dog and cat in chemicals, and you are not doing anything for the environment, for the house, for the yard, for your car, if you have a flea infestation and your dog goes in your car, guess what? They're going to get reinfested in your car. Because 95% of the life cycle is in the environment. And that's the part that people ignore. Now, granted, it's really hard if you go hiking in the woods with your dog all the time. You can't treat the woods for the ticks. So you've got to use some sort of a repellent. And let me tell you, essential oils are going to be, and the tick tags, those sorts of things that are going to be your best repellents. And these chemicals, the isoxazolines, the orals, they do not prevent fleas and ticks from getting on your pet. They kill them after they bite your pet. So they have to drink the toxic blood of your pet in order to die. So it doesn't repel them. And if you don't see ticks on your dog, you just don't have ticks. So stop giving chemicals that you don't need to give.